Hello, this is Dr. Behnam. I'm a board-certified dermatologist practicing in the beautiful Santa Monica, California. Welcome to one of our educational videos. This one today is called Botox. We're going to talk about Botox, how it is reconstituted, and what are the indications, and where we inject it on the face. So Botox is made by a company called Allergan. And basically this is one of the Botox bottles. The 100 on the bottle indicates that this bottle has 100 units in it. We pretty much get it delivered to us in the morning by FedEx, and then we open the bottle and basically pour a certain amount of bacteriostatic saline, which is basically sterile water, in it. Then we mix it, and then basically we are ready for injection. Botox has been around for many years. The Botox for cosmetic version came out in 2002. And over 11 million people around the world have been injected with Botox. It is very safe when it is administered by physicians who know exactly how to inject Botox. I personally have injected over thousands and thousands of Botox patients. And it is that skill that I bring to myself basically when I see and evaluate a patient of where areas to inject. The traditional areas basically where Botox is injected is typically in the lines between the brows. This is known as the frown lines. When Botox is injected into the muscles, it basically prevents those muscles from becoming activated. As a result, it relaxes those muscles. But relaxing the muscles in the frown area, basically the frown line smooths out significantly. Botox is actually indicated for what's called dynamic lines. Dynamic lines are the lines that we could create when we move our face. So for example, like right now, I'm trying to purposely make a facial expression. This is called dynamic lines. Static lines are the lines where you look at some people and they just have a line going down here when they're not moving the face at all. That's called a static line. The difference between the two is that Botox works great for dynamic lines, the ones that you could create when you make a facial expression. The static line, the lines that are already present when you don't make any facial expressions, Botox will certainly help, but in some cases might not be enough to get rid of those lines. In fact, you might need some fillers like Restylane or Juvederm to inject those areas in order to fill those. So, areas where you inject Botox is basically the forehead, basically the middle of the forehead right here. You could also inject basically forehead up here, basically for the forehead lines. You could inject the crow's feet, the lines surrounding the eyes. It works really well in those areas as well. I love to inject some of the areas where patients typically don't, where other doctors typically don't inject. One area is right on the lateral eyebrow. Inject about 2.5 minutes of Botox. You're going to get a very nice, beautiful lift of the eyebrow. You could also inject Botox in small amounts, basically in the lower eyelid area right here. Very small amounts. That will help with some of the wrinkles here, and also will sometimes change the shape of your eyes as well, going from narrow to a little bit more open. You could also inject little Botox around the mouth area. By doing so, is going to help with what's called the smoker lines, the lines basically around the mouth. Just be careful not to inject too much. Patients that have a downward going corners of the lip, you could inject Botox in a muscle known as DAO, depressor angular oris. You inject it right here and basically relaxes that muscle, and the downward drift of the corners of the mouth will actually go upwards. Some patients have neck bands. You could certainly inject Botox in the neck band areas and basically relax those muscles. There are a lot of places that you could inject Botox. I highly recommend that the person who's doing it has been doing it for a long time and has done it with over thousands of patients. That's the way they could basically prevent side effects from Botox. Again, this is Dr. Behnam. Thank you so much for watching our Botox videos. Please watch our other videos where we actually inject patients with Botox. Have a beautiful day. If you have any questions, feel free to give us a call at our office, 310-315-4989, or visit our website for other videos, santamonicaskin.com. Have a beautiful day.